Diagnosis for yeast is difficult. SIFO in particular stands for small intestinal fungal overgrowth. And this is just kind of a new name for, candida or yeast overgrowth. But it can be that it's overgrowing in the large intestine or the small intestine or both. And SIFO is specifically when it's in the small intestine. And Dr. Rao did those studies. It was wonderful that he did that. He diagnosed with culture, so endoscopy. So, the tube coming through the mouth, esophagus down into the small intestine, sampling what's there, the fluid and substances that are there, and growing out on culture to see if yeast grows. So, it's kind of like a gold standard, but it's an inpatient sort of a circumstance. I mean, depending on a gastroenterologist's office setup. So that's not practical for most of us, right? And by the way, the fascinating things in those studies that he found, because he also cultured for bacteria for SIBO. And what he found was the symptoms were the exact same, right? So this is why it's so important. One of our big differential diagnoses is yeast overgrowth, and particularly in the small intestine, because how do we know the symptoms are the same? So the other ways that you can diagnose it would be, you could consider, of course, doing a stool test. That's going to tell you if you have it in the large intestine. But I used to like to combine that with an organic acids urine test, because that has markers for yeast overgrowth and it can't distinguish between small and large intestine. But if you have that test and then you also have the stool test, like for instance, if the stool test is negative, but the organic acid test was positive, then it's in the small intestine. Now, if the stool test is positive, then you still don't know, for sure there's something in the large intestine. Maybe there's something also in the small intestine. It's really the best we can do unless we're going to get a culture test. And then the final test that I would often run is the blood test for the candida antibodies plus antigen. And that's a test to check if the immune system is deciding that yeast is a problem. And there's two things here. It could be deciding it's a problem. If it's positive, it could be deciding if it's a problem because there's overgrowth. But it could also be reacting to a normal amount of yeast that's not actually overgrown. And now this is yeast hypersensitivity, also a very pervasive problem. So one way or the other, that the person is having some trouble with their body, thinks there's trouble with yeast. So you can see how complicated this is and how imprecise it is and how difficult it is. And so in the end, my answer is we don't have a good test. I mean, yes, there's the culture for small intestine, but that's not practical for most people.